Of all patients that come through the door, about 2/3 of patients will become pregnant using first-line therapy. Then another 1/3 will need to move on to advanced therapy. And these are all forms of assisted reproductive technology, the most commonly known being in vitro fertilization.
We started with artificial insemination and, worked toward using some fertility drugs. And finally, it was determined that the in vitro fertilization would be the best direction for us. And it worked, first try. And
Well, our in vitro fertilization success rates are high for two reasons. One is just excellence and careful technique in all the areas that we do. How tight you are with ultrasound, with lab tests, drug individualization, all those things help you to have a good success rate. In addition, we have advanced techniques that we've incorporated in, such as blastocyst transfer, which is transferring the embryos on day 5 after we can select the better embryos, and doing this under ultrasound guidance so we can see exactly where to put the embryos within the uterus. Typically, patients are transferred on day 3 because it takes a very good lab in order to maintain the embryos to day 5. You have to have very exact culture conditions, and we have an excellent embryologist, Dr. Mark Dow, that works with us that has brought this technology to the Reproductive Center.
I think if you really, really want to have a baby, you can have a baby. I mean, there's so much out there, and I mean, he's here now, it was worth it.
Couples often choose the Reproductive Specialty Center as a place to have their treatment because we're known to have excellence in all areas of what you would need, whether it's in vitro fertilization, surgery, male treatment. And in addition, your treatment will be individualized to what you as a couple need in the most effective way possible.
We trusted Dr. Janik and the staff. The staff is amazing. When you're going through some of these procedures, you're not just coming here once a month. There was a point where I was coming in here every day for, a week at a time and working with the same people, and I couldn't have done that if I didn't feel comfortable working with them, and trusting them is a big part of it.